Q Health by Q Doctor video consultations. Single click instant video consultation. This is a demo of the Q Health video consultation functionality within the eConsult toolbar. The clinician can click on the video icon. They are presented with the NHS login with NHS Mail button, and they can also click on the pink icon to get Q Health support team anytime they need, 8 AM to 8 PM, 7 days per week. They can log in with NHS Mail. This will take them to a sign-in page where they will need to enter their email and password. They are then taken into the meetings page where they can create a single-click video consultation. They can create a meeting by clicking on Create for Now. This creates a meeting where they can copy the URL or invite the users straight from the invite page. They can invite via email, which is useful if the patient does not have a smartphone, or via SMS. The clinician can also invite their own smartphone via SMS if they do not have a webcam, or they can invite multiple other people. The patient will receive an SMS shortly with a link to join the meeting. By clicking on the link, the patient will be asked to enter their name and will be able to join the meeting. The patient can flip their camera during the meeting to show an area that they need to. The clinician or patient can then end the consultation. Scheduled video functionality. With scheduled video functionality, clinicians can click on Availability. They can then see the schedule functionality. You can add your own availability, and you can be attached to multiple practices, so you will need to select the availability that suits you. An administrator role can also perform this function. In this example, this has now generated appointment slots for yourself. At this point, you can generate appointment codes, which can also be done by an administrator. This code can be restricted to a particular clinician, time period, or day. By leaving it blank, it will set up a code for all availability at a given clinic. Again, this can be sent to the patient via SMS, email, or by copying to the clipboard and including in an eConsult post-consult message. This can then be sent to the patient. The patient will then be sent the appointment code. They will need to copy and paste this code and either be routed to the website or App Store, depending on their device. Please note, a no app download route can be configured for practices if preferred. In cases where an app redirect happens, if the app is already installed, it will open on the device. The patient will then paste in the code and will be asked for their name and date of birth. If the app is not installed, it will open the App Store and direct them to download the app. This will then give them all the available slots they have been able to see by the clinician through the appointment code. The patient will need to select an appointment slot that works for them. This will bring up a data consent notice on data recording, which will be set by the data controller. This will then book the appointment. Once clicking OK, they will be placed into a waiting room. The patient can then leave the app and when the clinician starts the appointment, it will start an inbound call on the patient's phone. By answering it, it will open the app and start the video consultation. The clinician has more functionality here. He or she can zoom in and out and tilt the screen left and right. The patient can also flip their camera to show something in more detail. The patient can also upload photos during the call. They can either select a photo from their phone gallery or take a photo using the device's camera. This will then be sent to the clinician. If they have a previous photo or image, they can choose this from their camera's gallery. The clinician can also press safeguarding. This will open up the nearest in-hours and out-of-hours phone numbers to make a safeguarding referral if they were worried about the patient. Or they can open clinical guidelines. These can be configured to the practice. This list is a set of links applicable nationally to GPs. They will open in a new browser tab. There is a Show Providers function. This will allow the clinicians to show the nearest providers of NHS care. This can be sent directly to the patient during the call. The patient can open the map to see the nearest pharmacies in this case. The clinician or patient can then end the consultation. There are a series of questions which are shown at the end. These can be configured to different practices, CCGs or PCNs to collect metrics. The patient is also given a score rating at the end of the consultation and another set of questions which can be configured by the practice. View of the organisation dashboard. This dashboard has been put together at an STP level. You can see the hierarchy of the different organisations and their controls. The super admin users have access to all administrators and can add or remove more across the organisation. You can see the sets of clinics and clinics within hubs that have different setups and their users within this. They have a view of concurrent seat usage and can download usage and questionnaire data from any given time. They can also download recordings of consultations, so any asset control roles users have in an organisation can be accessed here. Users can also be shown real-time metrics across the organisation, depending on the data permission levels that they have.